Okay, let's get started. Signs of labor. How to know when it's time. No one really knows exactly what initiates labor, but it is the placenta that determines the timing. It produced the hormone HCG that started pregnancy and now produces a different one, corticotropin-releasing hormone, CRH, that ends it. This sets in motion a series of other hormones, most notably from the adrenal glands, that leads to birth. This unknown timing can cause anxiety for mothers, and we receive so many questions on how do I know that labor has started. Let me go over some of the emotional and physical changes that a mother's body goes through that signals labor is near. In the weeks leading up to labor, you may notice some of the following signs that the main event is not far off. Increased vaginal discharge, the nesting instinct, this sudden urge to clean the house, organize the nursery, scrub the cupboards underneath the stairs often occurs in the run-up to labor. Braxton Hicks contractions. These are painless, irregular contractions that happen throughout the second half of your pregnancy, but some women report an increase in frequency at the end. Toward the end of pregnancy, these practice contractions may also be stronger and more intense as your body prepares for labor. Lightning. Sometime during the last month of pregnancy, the baby will drop lower and begin to engage for labor. While this doesn't mean labor will happen immediately, it is a sign that your body is starting to prepare. As the baby moves further down, you should be able to breathe more easily and may find heartburn and indigestion reduced. Weight loss. During the last month of pregnancy, the amount of amniotic fluid starts to decrease, so you may notice a reduction in weight gain, or you may even lose a little weight. As you near your due date, you are probably waiting nervously for signs that labor is about to start. It is important to remember that only about 5% of babies are actually born on their due date. Lots of babies are born after their due date, so you may have a couple of weeks of pregnancy left. Early labor signs. If you have never experienced childbirth before, you may be worried about what it feels like. Many women worry about how they will identify labor and whether they'll contact their healthcare provider too early and be a nuisance, or too late and end up giving birth in a taxi. To add to these worries, all too often when women ask questions about how they know when labor begins, they are told, "Oh, you'll know." Signs of early labor include menstrual cramp-like pain in the lower back or abdomen region, a bloody show, your water breaks, regular contractions. Sometimes you can start to shiver, an urge to use the toilet, and your moods start to swing. The only real sign that labor has started is the onset of regular contractions that cause the cervix to dilate. That said, there are a few other telltale signs that can indicate that labor is imminent. False labor could be a sign that labor is imminent, as these contractions are thought to cause softening of the cervix in preparation for labor. Mucus plug and show. The mucus plug has been sitting at the entrance of your uterus since the beginning of your pregnancy. This mucus plug has kept your baby safe from the outside world, creating a sterile environment in your uterus. As your cervix softens and begins to dilate in preparation for the first stage of labor, the mucus plug is dislodged. This is known as your show or blood-stained show. It is usually a mucus tinged bright red or brown. You may notice it in the form of a heavy vaginal discharge, or you may not notice it at all. This can occur as soon as 6 weeks before the birth, although it is usually a sign of imminent labor. You should notify your healthcare provider when you lose your mucus plug. Waters breaking. Hollywood always seems to depict this as the moment labor begins, although in reality most women are already in labor when it occurs. For the women that do experience it, however, their waters breaking is usually a clear sign that labor will start within 24 hours. The water is in fact amniotic fluid, which is released when the membranes of the amniotic sac rupture. The rupture triggers the release of prostaglandins, substances that cause uterine contractions. You should take note of the time of your waters breaking because your healthcare provider may ask you for this information. Amniotic fluid should be clear. If when your water breaks, the fluid is stained green, yellow, or brown, this could mean that the amniotic fluid contains meconium. This is your baby's first bowel movement and can indicate that the baby is in distress. If your amniotic fluid is discolored, you should contact your healthcare provider immediately. Shivering. Some women report involuntary shivering or trembling before the onset of labor and during early labor. Some women find that this worrying, but try to relax. It is a sign that labor is imminent, so check that your hospital bag is packed and you have everything you need for the birth. An urge to use the toilet. As your baby gets into position for traveling down the birth canal, his head may press against your bowel. This may give you a sudden urge to visit the bathroom and can be a sign that labor is fast approaching. Alternatively, your baby may press against your bladder, leaving you in a desperate need of a wee. Your body is just making sure there is enough room for the baby to be born, so expect a few bathroom trips in early labor. Labor hormones are thought to have an effect on the intestines, causing diarrhea to clear the digestive system and create more room for baby. A good night's sleep. Anecdotally, some women report having a long sleep the night before labor started. While this has not been studied, it could be the body's way of conserving energy in preparation for childbirth. Alternatively, it could simply be that you are exhausted after the energy drive of nesting and need to catch up on your sleep again. Restlessness. Some women report feelings of restlessness in the days leading up to the birth. This could simply be that they are waiting for labor and are unable to concentrate on much else. Lots of parents are ready for the baby by the due date, and time can seem to slow down for the days following as you wait for labor to start. Mood swings. Some women report experiencing mood swings or heightened emotions just before the onset of labor. Of course, this could simply be the frustration of waiting for labor, the worry of how labor will feel combined with sleep difficulties of late pregnancy. However, it may be a sign that labor is approaching. What should you do in early labor? Speak to your healthcare provider when you think labor has started, but it is likely they will encourage you to stay home until your labor is more established. Making the transfer to the hospital can actually slow labor if you are not yet experiencing the contractions of established labor. There are a number of things you can do at home during early labor. Distractions. Try to distract yourself from any discomfort by staying entertained. Watch a film or TV show, read a book, play board games, or just simply visit with your partner. Stay active. Moving around and staying active can help labor to progress. Take a short walk around the block, bounce on your birthing ball, or try walking up and down the stairs. Be careful not to tire yourself out though. Chances are you've got a long day ahead of you. Eat and drink. It's important to stay hydrated during labor, so make sure you are drinking enough water. Some women find that labor puts them off food, but if you're feeling peckish, have a snack or a light meal to keep your energy levels up. Try to get some sleep. You'll need your energy for the marathon ahead. If the contractions are keeping you awake, speak to your healthcare advisor about safe pain relief to take, to help you get some sleep if you can't sleep. At least try to rest. Try to stay relaxed and focus on the birth. Having a soak in a warm bath can help you to feel calm about labor and can ease any discomfort too. As the contractions intensify, you should utilize any breathing techniques learned during pregnancy. Breathe in as the contraction starts and then exhale slowly. This technique can help you to stay calm during contractions. When you do go to the hospital, for those of you who are having a hospital birth, the first stage of labor can take hours, and research has found that labor progresses better when women are in familiar surroundings. For these reasons, many hospitals advise women to stay home for as long as possible. Your healthcare provider will want to speak to you regularly on the phone to determine when it's time for you to travel. As a general rule, when you are no longer able to talk through contractions, and when you have been experiencing contractions lasting at least 45 seconds every 5 minutes for an hour, you should be heading to the hospital. You should also contact your healthcare provider if your water breaks, you notice a reduction in fetal movements, you have a fever, you have a severe headache, you experience problems with your vision, you have vaginal bleeding, you're experiencing signs of labor and you're not full term yet. As you wait for labor to begin, make sure you are fully prepared for the baby's arrival. Is your freezer stocked up with cooked dinners? Is the house tidy? Is the car seat unpacked and ready for use? If you are ready for the baby, enjoy your last few days as a couple before the baby arrives. Go for walks, eat out, go to the cinema, and enjoy some me time.